Assalamu alaikum and good day everyone. Today's article is titled Potential Predisposing Features of External Cervical Resorption, an Observational Study. It was done by Patel and others and was published in IAJ in 2024. As known, external cervical resorption is the loss of dental hard tissue due to odontoclastic action, typically initiating in the cervical region of the tooth. It is triggered by damage to the PDL and underlying precementum. Prevalence appears to be increasing in recent years, likely due to the enhanced diagnostic capabilities of CBCT. While its exact etiology is unclear, common suggested factors include orthodontic treatment, dental trauma, and parafunctional habits. Recent hypotheses have even suggested a link between domestic cat ownership and ECR due to potential feline virus transmission. So this study aimed to investigate potential predisposing factors such as trauma, orthodontics, and even domestic cat ownership to improve early diagnosis and clinical knowledge. It was a retrospective observational study where they assessed 215 ECR lesions in 194 patients referred to specialist endodontic units in London between 2017 and 2022. Patients were interviewed using a checklist of potential predisposing factors based on existing literature, and clinically, specialists performed systematic clinical exams using dental operating microscope, and for radiographic examination, the diagnosis was confirmed using both PAs and CBCT for every case. For the results, they reported the prevalence of factors as 57.7% of the cases had a sole identifiable factor, 20% had combined factors, and 22.3% had no identifiable factor, which were idiopathic. The top predisposing factors, including orthodontic treatment, accounted for 25.6%, followed by dental trauma, which was 20.9%, cat ownership, 15.8%, and parafunctional habit, which was 10.2%. For the trauma, it was significantly associated with maxillary incisors and more frequent in males. And for the cat ownership, it was significantly associated with molars and mandibular teeth. And for the parafunctional habit, it was significantly more common in females and associated with premolars. For the interpretation of these results, for the history of orthodontics, the high forces in the cervical region may cause tissue necrosis, leading to osteoclastic activity and predispose the tooth to ECR. And for the cat ownership, this supports the hypothesis that a feline virus, specifically feline herpes virus type 1, might be transmissible to humans and induce osteoclastogenesis. For the parafunctional habits, chronic mechanical loading, such as patient-wide bruxism, may create a hypoxic microenvironment in the PDL, increasing osteoclastic activity by 2 to 4 folds. And finally, only 2.8% of cases were linked to bleaching, and this decreased from older studies likely due to the modern avoidance of heat-activated high-concentration bleaching agents. So in conclusion, most ECR cases are associated with at least one predisposing factor, primarily orthodontics, trauma, or cat ownership. And identifying these factors during clinical assessment can assist in the early diagnosis of ECR. However, this paper has some limitations. First is the recollection bias, where it relies heavily on patient memory for events that may have occurred decades ago, which may lead to underreporting of important factors. And for the cat ownership, although the findings of the study supports the hypothesis of feline herpes virus, they did not test patients for the virus antibodies, and so causal relationship cannot be established. And thank you so much.